Folks, let's go ahead and get started. My name is John Lohman. I am the publisher of the Corridor Business Journal, and I want to welcome you to our latest free webinar as part of our Corridor Rising 2.0 series. As many of you know, we at the Corridor Business Journal host a lot of events throughout the year, and with the COVID-19 crisis, that obviously has impacted our ability to host in-person events. So we decided to put together some webinars, free webinars for our readers and interested parties to help navigate their businesses and organizations during these challenging times. And so we have been doing webinars on Tuesdays and Thursdays for the entire month of April. We've had some great content over those weeks, and we've got some great content today for you. We're fortunate to have, I think, probably four of the experts in the nonprofit world from throughout the corridor with us today. And they're going to be sharing with us their expertise, some of the lessons learned that they've been going through with regards to the COVID-19 crisis. And we're just going to have a informal discussion. We are, I believe, on Facebook Live today, so welcome to all our Facebook friends. And we are taking questions for our speakers today. And so if anybody has questions and you registered through our Zoom, you can ask those questions through the Zoom feature, or you can put those in the chat section, and we'll do our best to get those questions to our speakers. So we've got Carla Twedt-Ball, the Senior Vice President for Programs and Community Investment with the Greater Cedar Rapids Community Foundation. We have Kristen Roberts, the President and CEO of the United Way of East Central Iowa. We got Shelley Meharry, the Executive Director of the Community Foundation of Johnson County. And we have Katie Knight, the President and CEO of the United Way of Johnson and Washington counties. And if anybody's got a handle on what's going on in the nonprofit world, these individuals do. And so we're going to dive right into the discussion. And we're going to start with kind of a general question, and I think we're going to start with Shelley. You know, how is your organization and the nonprofit organizations that you work with handling the COVID-19 crisis? So why don't we start with Shelley, and then we'll go to Carla, Kristen, and then Katie.
John, thanks so much for hosting us to have this conversation. We sure do appreciate it. And would just like to also start out the conversation by thanking all of the individuals that are making our community stronger during this time. Whether you're a frontline healthcare worker or a delivery driver, a farmer, store clerk, teachers, volunteers, you are all making a difference, and we feel it every single day. So a huge thank you to everyone who's working so hard right now. So from the Community Foundation of Johnson County standpoint, I actually had a unique opportunity in the month of March. So March 9th through the 11th, I was in Washington, D.C. attending a conference. It's called Foundations on the Hill, where we meet with Iowa legislators to talk about nonprofit policy and how to create opportunities that make charitable giving advantageous for donors. And so while we were out in Washington, D.C. at that time, you know, being on the East Coast, they were really feeling the incoming effects of what COVID was going to happen in our communities. And so I had that unique opportunity to be reporting back to my board of directors and my staff to say, we have to figure out how we can get our operations online and remote really quickly. And the other thing that we did immediately was activate our continuity of operations plan. And this is something that I would be happy to share with anyone in our audience after the fact. And I know Carla would have information regarding the Iowa Council of Foundations as well, but just a detailed plan of how we would put our operations in a remote setting should we need to. And so we activated that continuity of operations plan. When I came back to the area after that conference, I was amazed in how just a couple days travel had changed. And it was just really clear how we were going to be impacted. And so we also activated at that time our emergency response fund, knowing that our nonprofit organizations in Johnson County would be asked to step up in any way that was necessary to help our community get through this. So we activated our emergency response fund, and our board of directors committed the first $25,000 to support that efforts. And so that was really our first key pieces, as well as communicating with our nonprofit partners that we were there for them and had activated this fund and could start working together as quickly as we could to be a resource for them.
Great. Carla, you want to go next?
Sure, absolutely. Yeah, we've been working from home since probably the same time all of you have been doing that as well, March 16th, with just a couple people in the office for, you know, essential kinds of things. We were actually in the middle of a grant cycle when this all happened, and it was our usual spring cycle where we fund, you know, programmatic efforts from nonprofits all over Lynn County, as well as organizational development, so capacity building kinds of grants. And we came to the really hard conclusion that we needed a redo on that. And that was not an easy decision to make because people put a lot of time and effort into the applications that they had submitted. But in looking through them, you know, there were a lot that just were not relevant, that they wouldn't have been able to carry out. And we also knew that our unrestricted resources at the Community Foundation were going to be a bulk of our response that we were able to do, and that we were looking ahead to a long-term crisis. So we're finishing that cycle right now. We don't normally make general operating support grants, but a lot of these will go toward helping nonprofit organizations figure out how to weather the gap during this time, and then some will go toward some of the human service needs as well. As it relates to human service needs, we worked right away with United Way to set up an emergency response fund. So it's the COVID-19 Disaster Response Fund at the Community Foundation. And I know my colleague Kristen will talk more about United Way's efforts too. But with that fund, we've been addressing some of the human service needs that are vital in this time period. So, you know, food and shelter and those sorts of things.
Great, thank you for that. Kristen, let's go to you next and tell us a little bit about what's going on in the United Way world, and how are the organizations that you help fund dealing with this challenge right now?
Yeah, thanks, John. Thanks for hosting this. We were similar, as Carla said. We started working from home as an organization the week of March 16th, and there was some real adjustments with that. I think the one thing that our community has is, since the flood of 2008, we all have been able to work with some business continuity plans. And so because of that, United Way of East Central Iowa, we had a really good business continuity plan. And so we were able to turn very quickly within about 24 hours, 48 hours, to be able to get people working from home. I think one thing that we also have that was born of the 2008 flood is what's called the Lynn Area Partners Active and Disaster Group. It's called LAP-AID, and it's normally about 30 to 40 organizations that come together during this time. And so for our community in general, that group of people and those organizations, municipalities, faith-based organizations, they started meeting before COVID was actually active in our community. And so one of the things that United Way of East Central Iowa does is we're the hub and the fiscal agent for that group. And so we have had multiple staff members. I can think of about at least 3 to 4 right now who spend almost the majority, if not their entire day, on LAP-AID work. And so we have been working toward that for those collaborative solutions within the community. We also then took on, as Carla said, we spoke with the Greater Cedar Rapids Community Foundation, and we worked together to create that fund. And then we also started our own COVID-19 Care Fund. And what I think is really neat, Carla, we've had this discussion, is how we are working in concert with each other. So Carla and the Greater Cedar Rapids Community Foundation is going through their process right now. And then we're working with them to be able to see who have they funded, what needs have been met, what more is out there, and then we'll be able to respond as well after, and be able to continue working in concert with each other. I think when you look at the way other nonprofits have really had to change, I think the business continuity piece has been huge. I mean, how many of us had sat down and really had a Zoom meeting, and not only one, but multiple ones back to back to back in one day before this happened? And so I do think there's a real resiliency within our community and an adaptability that we've been able to really take on, and our nonprofits have been able to do as well.
Great. Katie, you want to give us some input on how your organization at the southern end of the corridor is handling this?
Yeah, we have been so fortunate to have a lot of the community to be able to immediately open up our community disaster assistance fund. And we did, that actually has existed and been inactive since the floods, and the tornado was that we had was what started it. So we opened that up. That fund is works really well, I think, with the Community Foundation of Johnson County, because we actually help individuals. So we have folks that are contacting us for rent assistance, household supplies, and medication needs. And then we pay the vendors for what they need so that they can get that support. That is something that, again, was set up by the emergency management system and the COAD many years ago, and is still in place. Unfortunately, the fund is dwindling quickly, as you can imagine, with the economic impact that so many people are facing. We also are the emergency volunteer center, and we activated that immediately as well. We've had a lot of support from 188 different volunteers that have volunteered either for events or assisting directly nonprofits that needed the assistance, and United Way is kind of the central point for that as well. The team that I have, we've got 8 of us, and they have just done an incredible job to make sure that they're engaged at emergency management. And so Patty Fields is very involved with the emergency management team in Johnson County. And in addition, then we're also trying to make sure we stay connected to our donors and our partners, our corporate partners and so forth. So we immediately started providing ongoing daily information during the week to all of the corporate partners. And now we have individuals and others that want that kind of information flowing to them from all kinds of resources. So really busy, and I don't see it slowing down. And unfortunately, I'm not sure that we'll be able to keep pace with the economic needs. And so we'll look to as many folks as possible that can support the United Ways and the community foundations to make sure that we can move forward with our work. But incredible donations. We actually got a donation from someone that said that they wanted to give back part of their stimulus. So, you know, people are doing incredible things, and we will make it. And as Kristen said, we're a resilient corridor, I believe.
Great. Thank you for that. Kristen, I want to go back to you. I think you have a handle on a survey that might have been done on nonprofits throughout the region. Do you have some kind of statistics for us on those surveys, and what did those surveys tell us?
Yeah, back in March, it was the week of spring break, I know, in Cedar Rapids, the Iowa Economic Development Authority, the IEDA, they sent out that small business or business survey that they were really pushing for businesses and nonprofits to fill out. And Katie and I were lucky enough through our United Way of Iowa network to be able to speak with the gentleman who facilitated that for IEDA, and he broke it down for the nonprofit respondents for us. And of all the respondents and replies, about 10% of them were from the nonprofits. And most of those self-identified as either social services or healthcare, but there was also some educational and arts and culture nonprofits in there too. But at that point in time, 88% said that COVID-19 would negatively impact them and their business structure, mostly in the business operations portion of it. Third was in the fundraising piece. And most of them in 30 to 60 days. So if you think if this was taken back March 17th to the 23rd timeframe, 30 days out, we're there right now, expected about a 50% decrease in revenue and about a 34% decrease in employees. So when you think about what they were thinking as to how COVID-19 would affect the business, we're now at that point and seeing that.
Thank you for that. I'd like to just stay on this topic for a second, and maybe I go to Shelley next. Are there some sectors within the nonprofit world that you're seeing that are a little bit more negatively impacted by the COVID-19 crisis, or is it just across the board? And maybe we'll start with Shelley on that one.
Right. Well, when you think about, I think about our emergency response fund that we have at the Community Foundation. And we're so proud to have raised about $180,000 into that fund, but at the same time, the needs that come in, the applications that come in are so great and so vast. And so we really have to implore the almost like Maslow's hierarchy of need, funding the organizations that are providing services to the vulnerable, those critical services really, those really rise to the top. But that doesn't mean that the other organizations like arts and culture, for just as an example, are not as important and as vital to our community. And so the nonprofit landscape that we see here in the corridor is so vast. It's health and human services, it's education, it's arts and culture, it's animals, it's the environment, and they're all being affected by this right now in different ways. And so we have to really be conscious about either being able to fund where we can or rising up the need that others have to be supported.
John, if I could just add to that a bit, I know that Kristen and Katie will reflect well on the issues going on in the human service sector, which is really vital. In terms of the organizational sustainability, some of them have government contracts and so forth that will be able to sort of help, hopefully for many of them, get them through this time. For arts and culture, it is something that we're really worried about. I reached out to some of our arts and culture organizations in the Cedar Rapids area. And so Katie Hallman said to me, I'm just going to read this so that but she said, arts and culture organizations bring joy to our community. They help people thrive. And then she cautioned me about the need that we all have to continue these quality of life investments. And, she said these organizations inspire hope and excitement for the future. So, as a whole, these arts and culture organizations are really focused on continuing engagement with their donors and with their patrons. They've done some really creative things for this, but I think is an existential crisis for them. They've had major fundraisers that have been canceled. And so that's something that we're concerned about. So we're obviously doing a lot of funding of COVID related needs, but we will also be doing a lot of funding of the arts and culture organizations. And we've been encouraging our donors to continue their usual giving patterns as well, because, it's very easy to gravitate toward all the funding going toward COVID needs. And, philanthropy can be a really important piece in filling some of the gaps from the federal programs, but the bulk of the dollars for that is going to come from, federal, state, local resources, whereas arts and culture are really heavily dependent upon the earned revenue that they gain, as well as foundation and philanthropic support.
Good, thank you. Kristen or Katie, anything you want to add to sectors that you see are really getting either hammered or just another general observation on the landscape in your area?
I think the one thing that I would add is when you look at the emerging needs, initially the three that we really saw coming up were emergency child care, food distribution, and individual income loss. And I look at, I was on the phone with Jane Boyd, Community House, yesterday, and one of the things that they talked about was normally they start their summer care program on about the second week in June. Well, now all of a sudden they're starting it on May 4th. And if you think about that, it's wonderful because these are kids of essential workers. They need a place to go and the parents need to have a safe place for their kids to go. But what that does is their expenses are just skyrocketing. And so how do they overcome it? Is it a good thing that they're doing? Absolutely. They are stepping up into the community, but how are they going to afford it? Because what the parents pay do not cover the entire cost. And so there's a missing link there that's going to need to be overcome. And they're just one example, right? You could look at Foundation to Mental Health. You could look at so many of these different nonprofits providing essential services that have gone through the roof right now, but they may not get the funding that covers the gap for them.
Carla, I want to go back to you. You guys touched on this topic about the floods of 2008 and some of the practices that we've been able to learn. Does this feel like 2008 with the floods? And can you just talk a little bit about some of those other lessons learned from a previous crisis?
Yeah, I have to say, John, I think we are in a better place for being ready for a response because of 2008. And I think, for instance, this ability to, pivot to working from home. So many of our organizations after 2008, when they built back, they went online for things, and everybody's been doing that anyway, but just this real, sort of awareness of what it takes to transition an organization on a moment's notice. So the whole Lynn Area Partners Active in Disaster, that's something that, we've been really involved in as well. So that's, again, something that was an outgrowth of 2008. That being said, no, to me, this does not feel like 2008. And I think in part because when we have had the flood situations, we've had this area of immense devastation that is geographically finite. And this is not. It's everywhere. It's everybody. It's all over the country. So it's just such a vastly different situation. Whereas in the flood, we could have all these helpers surrounding the area of devastation to come in and be part of the solution. And that sort of in-person, on the ground, pull together response is not something that we're able to do in that way right now. So I think that's one thing that's really different. And just as a sort of tangible example for this, we've been talking with the Economic Alliance. We have done 2 cycles with them of a job and small business recovery fund to help the small businesses in the recovery, which is critical. I mean, we all need to make sure we can keep our businesses afloat as much as we can, but it's one thing to do fundraising and to do support of a geographically finite group of businesses, but how to get our heads around supporting business recovery at a time when it's everybody and all the nonprofits as well. So it feels substantially different to me. I'd be curious to hear what my colleagues think.
Kristen, maybe we go to you next on this question, because I know you were leading a different nonprofit during the 2008 floods. What's this feeling like to you right now?
Yeah, actually, I wasn't leading a different nonprofit in 2008, which I'm thankful for. But I agree with Carla. I think the one thing too, when you look particularly at the fundraising side of it, when you look at 2008, we were so geographically isolated that we had donations and funders coming in from across the country who had a Cedar Rapids tie. And it may be one of those situations where they are a vendor of Quaker Oats or a vendor of Alliant, and they're based in California, and all of a sudden they're giving us dollars. Well, that's not the case now. We are just one community out of their entire, maybe even global network of communities that they support. And all of a sudden, Cedar Rapids isn't top of the list anymore. We're fighting with, a Seattle or a New York City, where they are the true hotspots with COVID-19. And we've done a fairly good job in Iowa in comparison. And so I think that to me is the real difference in all of it. And there was, again, economic loss in the flood of 2008, but this is so vast. And it also moves the conversation from the most vulnerable to my neighbor. And I think that's another huge difference when it comes to fundraising. I think it's an opportunity, but I think that that's something that's completely different than what we've had in between, say, 2008 and 2020.
Yeah, let's stay on. Thank you for that. Go ahead, Shelley, did you have something to add?
Yeah, I was just going to add that in 2008, I was Director of Patient Relations at UIHC. And something that comes to mind for me is just the creativity that our region has in solving problems. And so something that comes to mind is during the flood of 2008, you'll recall, our community was flooded with insurance agents, brokers, building contractors that were really utilizing all the available hotel rooms that we had in our community. And, working together with the university, realized that we had this untapped resource in the dorms at the university that we could tap into to house patients and families while they were having their care at UIHC. And so that situation resonates with me in opportunities now when we're hearing of unique groups coming together and partnerships happening to meet the needs now. But again, I would echo the sentiment that this is definitely different when this crisis is impacting everyone. And it's not an us and a them sort of situation. It really is all of us.
You know, Katie, I think I want to go to you next. Kristen touched a little bit on the fundraising component. And so how do you see fundraising changing right now? How challenging is it right now? And kind of how do you see that evolving over the next several weeks and months?
Well, John, as I said, we do have our fund and we are actively fundraising for that from individuals and companies. But we also know, Kristen and I have actually had a conversation about this, that we have an annual campaign that has to start up here pretty quick and run. And so Kristen and I and some of our staff have had conversations about working together in different ways to maybe consider something along the corridor. But I think that the really big difference in this campaign is going to be, it has to be fun, it has to be virtual, everything about it has to be different. And we as United Ways rely so much on leaders like yourself and others in our community to be the champions for us and out there and talking with business leaders. So we have campaign cabinets and they meet on a every other week basis and those kind of things, and all of that's going to change. And the other thing that we know we have to face is that, quite honestly, we have money that comes in from 3 different campaigns over a time period, just based on fiscal year 19, fiscal year 20, and now we're going into 21. We don't know what kind of money is going to be able to continue to come in, because that's all based on employee giving. And those employees may not be there, and the companies ultimately may be really struggling significantly. So the money that we have for anything we have in reserves obviously is very important, and we need to be very strategic about using it. But it's a whole new ballgame for United Way. It's a very peer-to-peer type of fundraising and paying attention to individuals and being able to talk to them. I have reached out to some of our major donors and spoke to them just simply on a wellness call to make sure that they were doing well, not asking them for money, not talking to them about either one of the campaigns. But it's going to be a whole different situation. And I actually have more experience with hurricanes, but this is just nothing like that, because everyone in the world is impacted, and every individual that we know has a story they're going to be able to tell. And so, we can go to the areas as you all did in 2008 and support people, and as I've done before, but it's just not the same. We can't do anything the same way we used to do it.
So maybe a question for the entire group here. Are there any organizations that you work with in the nonprofit world that are really doing some creative fundraising components or creative fundraising programs that you might want to share with the people that are listening today?
I mean, I'd be happy to start. And I'll continue on the arts and culture theme a little bit. There's some really interesting things that they're doing to engage donors and patrons. When I talk with Katie Hallman, they're doing Coffee with Katie on Wednesdays, bringing in special guests. The Czech and Slovak Museum they're calling all of their members to check on them, using the chance for that to do a much overdue project of updating their donor database. They have a store, so they're taking online orders for that. They're sharing out entertaining and educational posts, and they've got a podcast that they're pushing out. The organizations everywhere, I think, are all figuring out how they're engaging their donors. They're reaching out on Facebook Live and other social media avenues. I think the real challenge for them is how they monetize that. And so that's definitely a way of staying connected with their donor base and with their patrons. But as this, or if this, but probably as this continues and doesn't wrap up in the next, month or two, then I think that starts to be really challenging because they need the income stream coming in as well.
I'll just echo that from the Johnson County area. Groups like United Action for Youth are holding art classes via Facebook, which is just so great to see. Big Brothers Big Sisters of Johnson County. When we think about our children, right now they're not in school. They're missing their teacher, they're missing their classmate. And so if you were a child who was vulnerable anyway, and maybe had a big in your life as a result of Big Brothers and Big Sisters, they're doing incredible work to try to keep that relationship going. And so, virtually they're stepping up in that way. And then likewise, our friends at Film Scene, if you've been to Film Scene, you know that there is a solid passion for their popcorn. And so they've implemented a Friday night ability for you to pick up popcorn and some snacks and stream some services from them. So just really unique ways that they're trying to engage their audience.
That's great. Go ahead, Kristen, you have something?
I was just going to say, I think from the volunteer standpoint, so we always have our Day of Caring. It's scheduled for May 14th. And I know many other organizations have done something like this too, where you go virtual. And the decision, I think that's so hard is do you continue with it and try to find a virtual component, or do you push it off? And do you reschedule it later? And obviously there's going to be this kind of climax of all of a sudden when we can all get together, there's going to be all of these events. And so what is that going to look like moving forward, right? How are we going to make sure that we're not stacked on top of each other? But I do think with like the virtual Day of Caring, there is value in still being able to have these things go on. The popcorn, right? There is an inherent value in being able to have that normalcy. Or for the Day of Caring, being able to do some sort of virtual volunteer work that makes you feel good, that makes you feel like you're a part of this and you are doing your part to help our community. So being able for our agencies to just twist it and be creative, I think is huge, not for them, but just for the community as a whole.
Thank you for that. There is a question from the audience, and it's regarding the government grants and contracts helping to sustain and pay for some of these services. But they're kind of questioning that are those grants, are they going to be given the opportunity to move those dollars to general operations where they might be allocated to a different area? Can anybody talk a little bit about that and moving funding restrictions?
I think I'm the one who had mentioned earlier about government grants and contracts, and I probably will defer the governmental part of that to my United Way colleagues, and hopefully they have some response to that. I'll just real quick mention on the foundation side, on the private foundation aspect of things, the foundation world has a number of what we call philanthropy serving organizations that help provide some of the thought leadership behind the work of foundations. And there are many of them, many prominent philanthropy serving organizations that are pushing foundations to think about releasing the restrictions of the grants that they've made and turning them into general operating support, thinking about delaying or making easier or terminating altogether the final reporting requirements to allow people time to deal with the crisis. So I would say to nonprofit organizations, know that that's a trend and be willing to ask your foundation funders whether they are implementing any of those measures. We have done that with the grants that come from our unrestricted pool. We've contacted all the current grantees and let them know that we will release the restrictions on that. Some of them can take advantage of that, some of them can't, but I think that is a question that nonprofits can and should be asking of their foundation partners.
John,
Yes, Katie.
In my past experience, I would say that federal funders have completely moved away from providing much assistance for general support and operating. So We do have a federal grant, and Kristen, United Way of East Central has a federal grant for our RSVP. It's pretty strict. In point of fact, we had to put in place a policy that covered all employees to be able to fund the folks that are being supported by the federal grant. So I think it really depends, though, in my experience, on the funders, the federal entity that is the funders, and also the nonprofits relationship, quite honestly, with the staff that they may work with. So, you know, I would hope that there will be some leniency in some of those areas, but for our annual campaign, the money that we give to our partner agencies that write grants to us is for operations. And that was intentionally done long ago to kind of fill that gap and be able to support.
I think another point, and Katie, I'm sure you saw this, United Way Worldwide has brought up this idea that the nonprofit sector is the third largest employment sector in the United States. And if you think about how a lot of the funding and federal funding and the stimulus bills usually don't include the nonprofit sector. And so I know United Way Worldwide is doing a lot of advocacy around that instance and that issue. And this goes to the point that the viewer brought up, is how are the nonprofit sector being so big and so broad within our nation? How is it being supported?
I'll just chime in regarding grants from the Community Foundation. So we have extended our grants deadline for any grant that was awarded in fall of 2019 to December 31st. The grant reporting deadline, and likely if needed, we'll certainly push that out further. Likewise, if there's an organization that's received a grant, and I'll give an example of the Baroque Land Trust, they received a grant to provide some education to their patrons and came to us to ask if they could convert those dollars into providing educational opportunities in a virtual format. And absolutely, that's a great use of redirecting funds. So I would just echo what was said about connecting with your funder to ask. We're all here to help in any way that we can, so definitely reaching out.
Carla, I want to go to you. There's another question specifically from someone in Lynn County, and they're talking about a project coming up that's not related to COVID-19, and basically it's environmentally related. The question is, will their application make it into the running with the local foundations, and what would be the best timing to apply given the crisis? Can you maybe touch on that?
I'd be happy to try. I can't speak for all foundations. The cycle that we're running right now is not just for COVID related. So that's from our unrestricted funds. We called it these come from our pool of funding that we call the funds for the community. So we just generically labeled this funds for the community cycle 1. So in that, we're taking a number of applications. In fact, most of those applications are not COVID related necessarily. They're more about sustaining the organization than they are about responding to COVID. So we're doing some of both. We would have another grant cycle in mid-June, and our plan, we think, is to continue that, but frankly, it's just been all hands on deck to get where we are right now. So that is a next week project to figure out what we need to do about that cycle, and then starting to push out the publicity. But I can state this with certainty, because this is a conversation that we've had already with our policy level committee and with the board, this concept that our funding this year needs to not just be COVID related. I mean, we clearly need to respond to the human crisis that is happening, and we will do that, and we want to do that, but we also need to respond to these organizations that are maintaining other really, really important work, like environmental causes in our community. You know, I think we've all taken note of this little pause that the earth has had with this, but we know that that's been environmental needs have been a really huge issue. And so, you know, it's something that I can speak for our foundation, but I can't speak for others, but it's important that we think about the whole of the work that we are doing.
Shelley, anything to add there?
So our largest grant cycle that we do opens July 1st. And we haven't made any decisions one way or another if all the funds will be directed to COVID related. You know, I can say the Johnson County community, you know, our foundation here is not as large as our friends to the north at Cedar Rapids. So, you know, our resources are more limited. And so there will be a conversation about the best strategic use of those funds coming up. Likewise, we partnered with other funders as well who utilize the Community Foundation to assist them with their grant making. And they are also reviewing their grant strategy to find out, you know, how best to use what limited resources they have going forward. It continues to be a moving target. You know, every day we get new information about how long this will potentially last. And, you know, now yesterday's communication that came out was really about a second wave of COVID coming into the fall and winter. And so it's just really kind of a wait and see and try to make the best decisions that we can for our area.
Katie, let's go to you next. You know, what advice do you give another nonprofit leader that's really struggling to fulfill that organization's mission during this time? You know, you guys are all leaders for nonprofit organizations. You've been in your roles for a while, and you're just leaders in general. So what advice would you give to another nonprofit leader who's really struggling to fulfill their mission right now?
Well, I think that the leader has to be able to step away from the direct service, which I know is very hard for many of our nonprofit partners, and step back and speak with their board, be very engaged and get your board engaged in helping you think through what's a contingency plan look like, short term and very potentially long term, looking at the financials. Take a look at your staff, make sure that they're getting the support that they need and the breaks they need. I just sent out a mental health document I found to my staff, because I know many of them are engaged in the flood and they just keep working day and go into night. And I think that feel proud though to be able to fundraise around your mission. And stories, of course, we all know are so important to get out to people so they understand the hard work that the nonprofit is doing. But I think that probably in particular, working with board and other leaders that you know in the community to give that individual leader the support they may need as well, because they're probably standing on that top of that hill going, oh my gosh, what do I do now? And how much longer is this going to face us? So,
Kristen, I want to bring that same question to you. You know, what kind of advice do you give to your friends in the nonprofit world that are really struggling at this point?
I would agree with everything Katie said. She brought up a lot of the points that I was kind of going in my head. One thing I would probably add is don't be afraid to fundraise, because this is the time in which your impact is so very vital. And I can't remember what email I got it from, but I remember seeing a status saying this many kids are missing blank, right? And that just was one of those moments where it's like, wow, we all know it. We all understand, like we talked about, kids are home, they're not in their schools, but every single person is missing something, and being able to express that piece and the value that you bring to the community and how you fit that need, I think is really important for people to express right now. It's just really solidifying that value that you as a nonprofit have.
John,
So
if you don't mind my jumping in really
Please.
quick, just to say, I think Katie touched on an important point about this is really stressful for nonprofit staff. And so I did just want to uplift that one of the efforts that the Community Foundation has had for many years is the nonprofit network that we have. And Carrie Walker is our manager of the nonprofit network. That was one of the pivots we made right away, that she holds peer group meetings for various roles that people have. So, you know, for nonprofit directors, for CFOs, development directors, managers, and so forth. So that was something that at first we thought maybe people would feel too busy to engage in. And so she put out, you know, an inquiry and got an overwhelming response back that no, we really need to connect with our peers. So we've moved those to Zoom, and that's available on our website. So that's something that is something that people can use to sort of connect with people who are in like situations and get that sort of peer-to-peer support. So that can be really useful. And the other place that I would just say that the Waterman Center at the University of Iowa has a really wonderful listing of resources for nonprofits. I always just find that to be a good go-to to check out.
You know, the next question we've got from the audience, and this is kind of a really big question, you know, what happens is if this is the new normal? We feel like we're in a crisis mode right now, and many of us are, but what happens if this is just the way it's going to be for a while? Have you guys thought about that, and how are you going to approach things differently if this is just the new normal going forward?
John, I think, go ahead, Kelly, go ahead.
Well, my short, answer is we'll figure out a way to adapt. I have to give such credit to, this is National Volunteer Week. And we often think about those who volunteer for our organization. But sometimes we forget to thank those who volunteer in our organizations, and that's our board of directors. They are people in our community who are passionate about the work that we're doing and really stand right alongside us during a crisis to figure out how we're going to get our own organization through this, but also how are we going to use our voice and our support for the betterment of the community. And so I think that we are all sort of bracing for how long is this going to last? And we're taking that into consideration. But I think the nonprofit sentiment that we all have is of support to our community, and we'll try to figure it out the best we can.
The one thing I would say to that is if you look at the nonprofit world, we are used to having to change very quickly. I remember being in an organization and the state contract came and they had to manipulate jobs within 60 days. And they did it. And so I think that's the one thing when it comes to nonprofits, we find opportunity and challenges. We find the silver lining and we're going to go for it. And I think that's one of the things that is, I don't know if it's a Midwestern thing, I don't know if it's a nonprofit thing, but I think that's one of the things that we have really going for us as nonprofits is being able to find the opportunity and the challenge and being able to pivot, like we talked about, this is called being able to pivot on what that is and grabbing it and going for it. And I think that's one of the real values that nonprofits have.
Thank you. So another question from the audience, and I think we touched on it a minute ago, but what are your plans to re-engage with your volunteers right now? Is there a plan to get engaged with those volunteers again in this time? I don't know if anybody wants to take that one.
I'll just say that our board of directors, which as all of you have, are super busy, engaged people, have been just outstanding in making sure that they're taking the time to go to a board meeting virtually and keep us moving and keep encouraging us. And in regards to other volunteers, as I said, we've actually engaged with 188 folks, and we do have safety questions we ask people, and we have requirements to protect whoever is going to be served. But we've just had some incredible stories of people that have stepped up with assets or expertise that help. And that's the way that we put those stories out, and then others come forward. So I think that this community, the corridor, is just an outstanding area for volunteer engagement. I'm extremely impressed with the whole area and the way that volunteers interact. We have the owner of Laundromania, who opened his 5 locations free of charge for people to go in and get their laundry done, and he even found ways to find detergent. The Think Iowa City leadership has just been outstanding in connecting us and the EOC to where they need to be connected. We had a shortage of rice for the pantries, and they've got Big Grove was repackaging rice for the pantries so that it was of a manageable size for families. And Airmark was connected to help with those clamshell so that we could make sure that people at free and reduced lunch that are used to going there and have a very specific way of volunteering, they can't do that. So they put the lunch in a clamshell and then they can hand that to the homeless. So I think that volunteering is a major ethic here in this community, and I think it's just going to continue to grow.
There was a nice comment on our chat that says, thank you all for your time and your wisdom. She said this was validating and demonstrates the cohesion in our corridor, and that collaboration is really important. So thanks to all of you for that. I think we got time for just one more final comment from everybody. If there's anything they want to share or say to our audience before we finish up here. So Shelley, why don't I go to you first?
I would just say how much we miss you. We miss seeing all of you and the good work that you're doing, and us being able to be a part of your fundraisers and attend your events and uplift the work that you're doing. We really miss you, and that we are incredibly grateful also for the work that we're doing in a small way. This is our contribution and our way to try to help all of us get through this. And so we're just really honored to be able to be a part of what's happening in our corridor right now. So thank you.
Great. Carla, you want to go next?
Sure. Shelley said it really well. So if I could say ditto to that, I will. I would also add, you asked about or there was a viewer question about the longevity of this and what will happen. And I think, one of my thoughts on that is the level of partnership and collaboration and the way that nonprofit organizations work together and work for the good of the community is going to be something that I think is even more vital going forward. So I am appreciative to live in a community that has just such amazing, dedicated people working in nonprofits, and that they're creative, that they are relational, and they work together in how they approach this. And I think that that sort of inherent value and skill that the nonprofit professionals of our area bring together is going to be ever more important as we go forward.
Thank you. Kristen, anything else?
Yeah, Shelley said it so great, didn't she?
Oh.
We do. We miss you. And if you think about the work that we do, like Carla said, we're so relational, and it is something that we miss. The one thing that I am forever indebted to is just the generosity of our community. I look at this and I see people coming out, as Katie said, someone got a stimulus check and they donated part of it. I think of the story of the widow's mite, and we have those people who may not have a lot of means, but they give a lot percentage-wise of what they can. And that is so ingrained in our community that I feel as if that's something that's going to help us all get through. We are united, no pun intended, but we rally around each other, and we just are a united community who believes in each other. And I think that's something that no one can ever take away from us, and that's going to be really vital for us in moving forward.
Great. Katie, you get the last word.
I would just say thank you to everyone in our communities. Everyone is important. Everyone has done something for someone and helped someone, big or small. We of course have the incredible leaders in our healthcare, our law enforcement, our teachers, but everyone is making a difference. And if we continue to stay positive and work together and reach out and help each other, I think that we'll make it through this first wave, and then we'll face the second wave if it comes.
Right. Well, thank you so much. And there was another comment just from our audience. It says, thanks to all of you for your leadership. No one signs up for a crisis. So thank you for helping lead our communities in this difficult time. So thanks to the four of you. I did want to mention just a couple upcoming things at the CBJ for people Our normally scheduled Innovation Watch event remains set for May 12th. The event was going to be in person, but now it's going to be a virtual event, and it will focus on some of the latest advances in technology in the corridor. And we're also planning for there to be a sub-theme on how innovation in Iowa is helping combat the COVID-19 crisis. So you might want to put that on your calendar. And our next webinar topic is coming up next Tuesday, and it's going to be a webinar on creative financing for distressed companies. So I know there's a lot of companies that are really feeling pinched right now. We've got some experts that really think outside the box and are going to come with some great ideas and suggestions that people might not be thinking about. So that webinar is next Tuesday, April 28th at 12 noon. Of course, you can go to our website at corridorbusiness.com to register and find out about our upcoming events. And then the last thing I'll just mention is that I have been asked by folks how they can help the Corridor Business Journal during this time. And I would just say that I would encourage you to subscribe to the CBJ, particularly the digital version right now. That's really the best way to help the CBJ continue to do what we're doing. And so thank you for participating today. Thank you, Carla, Kristen, Katie, and Sherry for, again, your leadership, and stay safe and keep reading the Corridor Business Journal. Thanks so much.